I was doing a consult today with a patient and I was reviewing their MRI with them and going over the results. And they asked me, why doesn't my primary point these things out when we're talking about bulging discs in their back, compression, spinal stenosis, all of these issues? And it's very similar to the chemotherapy and radiation therapy patients that I get, where their oncologist or treating physician will say, hey, there's a chance that you could develop neuropathy, and if it's not gone after so many months or weeks, then it's probably permanent. And the problem with this is that a lot of these doctors specialize in, let's take general health care, for example, that the only thing that they're worried about is making sure you're not having a stroke, a heart attack, and that you're taking your medications. They really don't have any other purpose. They're not trying to help you reverse your diabetes. They're not trying to help you lower your cholesterol. Some of them may, but for the vast majority, I would say 80 to 90%, it's probably not true. If you do have a doctor, that's great. Stay with them. The other part is that your oncologist is just worried about your cancer. They're not really worried about anything else. They're just trying to make sure that they get rid of your cancer. So when it comes to why they don't go over these things, such as like functional health or helping you reverse these processes, is because most of the time they're focused on something else and it's not something that they specialize in. And this is why I have a job and a profession, because I pick up where these doctors leave off. So if you want to learn how to reverse your neuropathy, if you want to learn more about me, or if you want to learn how I can help, click the link in my bio. There's plenty of resources in there. You can book a consult with me. If you're looking for help, there's YouTube videos over everything that I cover about neuropathy, about general health. And if you have a more detailed question, then just ask, okay? You can comment, send me a message. There are some things that I need more information to tell you about, but overall, I try to be as receptive as possible. So hopefully this helps. If you guys have any questions, just comment below. All right, bye.